It all began so simply. A normal breakfast, light conversation, then suddenly a sentence that didn't sound quite right. The words were slightly off, the tone unusual, or perhaps just a bit of slurring. Most would dismiss it as tiredness, poor sleep, or just age. But what if that seemingly harmless moment was actually the brain's only warning before a stroke? In the United States, someone suffers a stroke every 40 seconds. That's nearly 800,000 people each year. And among them, seniors over 65 make up the majority. The scary part is, strokes don't always begin with dramatic scenes, like in the movies. There's no collapse, no screaming, no visible pain. Sometimes, it starts with something so small, it goes unnoticed. A wrong word, a stuttered sentence, a strange pause in the middle of a conversation. Many people brush it off. Just stress, just aging. But that subtle shift could be the brain's final chance to call for help. Ignore it, and the result could be permanent paralysis, loss of speech, or a life forever changed. There is one early warning sign of stroke that is incredibly common, but most often missed. It doesn't hurt, it doesn't leave a visible mark, and it doesn't cause panic. But when recognized and acted upon in time, it can save a life or protect the ability to speak, move, and live independently. In this video, that overlooked sign will be revealed. Not just what it is, but why it's so dangerous, especially for older adults, how to recognize it right when it happens, and most importantly, what to do in that critical moment. Don't skip this, because that sign is more common than most people realize, and it's waiting to be noticed before it's too late. The human brain is one of the most oxygen-hungry organs in the body. Although it makes up just about 2% of total body weight, it consumes around 20% of the oxygen we breathe. That's because every thought, movement, breath, and heartbeat is powered by the neurons firing inside our skull. But what happens when that oxygen flow is suddenly cut off? In the case of a stroke, the answer is both immediate and devastating, especially in older adults. Every minute during a stroke, the brain loses an estimated 1.9 million neurons. That's 1.9 million individual brain cells, each one involved in vital functions like speech, memory, coordination, or consciousness, dying every 60 seconds. For seniors, whose brains may already be more vulnerable due to age-related changes, the consequences are even more profound. Time isn't just critical, it's everything. The type and severity of stroke symptoms depend largely on which region of the brain is affected, and understanding which parts are most vulnerable explains why certain signs appear first, and why we must pay close attention when something feels off. Take, for instance, Broca's area, located in the frontal lobe of the left hemisphere. This region controls language production, helping us form coherent sentences and speak fluently. Just a brief interruption in blood flow here can lead to slurred speech, missing words, or jumbled sentences. On the other hand, Wernicke's area, found further back in the temporal lobe, handles language comprehension. Damage to this region can cause a person to speak in flowing but nonsensical sentences or completely misunderstand what others are saying. These symptoms may seem minor at first, but they are massive red flags. Another critical zone is the brainstem. This area acts as the control tower for vital functions like breathing, heart rate, and blood pressure. A stroke here is particularly dangerous. It doesn't just affect speech or movement, it can shut down basic life-sustaining systems. People suffering a brainstem stroke may suddenly stop breathing or lose consciousness without warning. The danger is silent, swift, and often irreversible. Then there's the motor cortex, the strip of brain tissue that sends signals to your arms and legs. If a clot or bleed affects this area, the result is often weakness or paralysis, typically on one side of the body. If the left hemisphere is affected, the right side of the body may go limp, and vice versa. This is why people experiencing a stroke may have a drooping face, trouble lifting an arm, or dragging a leg when walking. The occipital lobe, located at the back of the brain, manages vision. A stroke here might result in sudden loss of vision in one or both eyes, or seeing visual distortions like flashing lights or blind spots. Again, These may seem strange, but not urgent. But in truth, they're another urgent cry from the brain for help. It's important to remember that strokes don't follow one script. The brain is a vast network of highly specialized regions, and depending on where the blood flow is interrupted, symptoms will vary. In older adults, this variability often makes detection more difficult. Families may think confusion or imbalance is due to age, but when symptoms appear suddenly, without warning or explanation, stroke should always be a top concern. The Mayo Clinic reports that left brain strokes, the kind that affect Broca's and Wernicke's areas, often result in speech disturbances such as slurring, mixing up words, or complete language loss. These signs can occur even before any motor weakness is noticed. That's why, in many cases, the first sign of trouble isn't a physical collapse. It's a sentence that doesn't make sense. The scary part, most people don't notice. A person might laugh off their garbled speech, or chalk it up to being tired. Their family might think it's just old age creeping in. But the brain isn't just misfiring randomly, it's suffocating. The neurons are running out of oxygen, and language, being one of the brain's most complex and sensitive functions, is often the first to show strain. In older adults, stroke symptoms can be subtle. Slurred words, forgotten phrases, or a confused look may not seem dramatic, but behind those quiet moments, brain cells are dying. With each passing second, the damage grows. So why does timing matter so much? Because the longer the brain is starved, the worse the outcome. A stroke that goes untreated for 5 hours can lead to permanent paralysis, loss of language, or even death. But one that's treated within the first hour, that could mean walking out of the hospital days later with barely a trace. The aging brain doesn't always scream when it's in trouble. More often, it whispers. A missed word, a wrong name, a sentence that feels off. These small changes are not just quirks, they're clues. And before the body fails, the brain often whispers a clue through speech, but few people hear it in time. A stroke rarely begins with collapse or dramatic pain. Instead, it often starts with something so subtle that it goes unnoticed. A shift in speech. It could be slower, more hesitant, or full of mistakes. These speech changes are often dismissed as normal signs of aging, fatigue, or stress. But in reality, they can be the brain's desperate attempt to signal distress. Language centers in the brain, Broca's area and Wernicke's area, depend heavily on a constant supply of oxygen and nutrients. Broca's area, located in the left frontal lobe, controls speech production and grammar. Wernicke's area, in the left temporal lobe, processes comprehension and word selection. These regions are especially vulnerable during a stroke because even a minor reduction in blood flow can impair their function. When oxygen is cut off, these centers struggle first, manifesting as garbled words, missing phrases, or nonsensical sentences. Imagine a polite conversation at the breakfast table. Everything is normal until your loved one hesitates mid-sentence. They reach for a specific word, but instead substitute something odd, calling the remote control a little black box, or referring to shoes as foot things. Suddenly, the smooth, expressive language they normally use seems unnatural. Sentences might twist into incomplete fragments like "I want the thing to eat." Their voice may quiver or trail off, leaving you confused. Such changes might only last a minute or two before vanishing, and because they disappear, often no alarms go off. People assume it was a slip, tiredness, distraction, aging. Doctors call these transient episodes word-finding difficulties, or apraxia of speech. But for stroke experts, this scenario is a red warning flag. Statistics from Harvard Medical School confirm what doctors have seen anecdotally. Over 60% of mild stroke patients experienced early language difficulties. Speech issues often appear before any paralysis or visible weakness. They may also be accompanied by subtle signs such as trouble finding comprehension, repeating the same phrases, or asking the same questions multiple times. The danger lies in how easy it is to misinterpret this symptom. Families might rationalize it. They're tired from cleaning the house, or they didn't sleep well last night. The person themselves might feel embarrassed and dismiss the incident as a one-time glitch, but that brief lapse could be a mini-stroke, a transient ischemic attack, heralding a major stroke up to 48 hours later. It's worth noting that age-related mild confusion often comes with broader symptoms, like general memory decline, slower thinking, or difficulty learning new things. But stroke-related speech disruptions are abrupt and isolated. Someone can usually still say other words, recognize whom they are talking to, and respond correctly. The contrast is fleeting clarity, muddled by sudden breakdown. That contrast is the clue. Here are some clear indicators to watch for. Inability to name objects. This is more than forgetting the name, it's substituting a different, incorrect word. It indicates a breakdown in the brain's retrieval system, fragmented sentences, and lost grammar. Instead of saying, "I'm going to the mailbox," they might say, "I go box." Words are there, but the structure is gone. Mid-sentence pauses with confusion. They might start a story about yesterday and suddenly stop, unable to recall the rest. Repeated questions or phrases, echoing the same question multiple times within seconds, like "Did we eat breakfast? Did we eat breakfast?" shows they can't track what has just been said. These examples are unnerving, but they're also lifelines if spotted early. The brain is giving an alarm, a spoken SOS. Most of the time, families ignore these clues, waiting for more obvious signs like slurred speech, arm numbness, or facial drooping. But by then, it's often too late. Another complication is that speech problems may come and go. A loved one may stutter during one breakfast and be perfectly lucid the next. This intermittency creates a false sense of safety. It's like intermittent beeping. It still signals alarm, but people become inured to it. For stroke, inconsistency doesn't mean danger is gone. It means it's just slipped away, temporarily. Acting on these subtle language disruptions could be life-changing. It could mean saving someone's ability to speak, walk, or eat independently. It could be the difference between living alone for years or needing long-term care. Asking the right questions can trigger faster response. A simple check. Can you tell me what this is? Holding a spoon or cup. Watch how they respond. Hesitation, improper naming, or awkward phrasing are strong indicators. Awareness is the first defense. Families must be educated to recognize abrupt speech problems, even when everything else seems fine. A pre-made guidance sheet listing sample sentences or word tests can help people act without panic. And while not all speech disruptions mean stroke, erring on the side of caution is vital. The risk of waiting is far greater than the inconvenience of calling for help. In stroke treatment, minutes are measured in lost brain cells. What may seem a minor language hiccup might be the brain's faint whisper before collapse. So if the words feel off, what's the next step? Waiting could be deadly. In stroke care, medical professionals live by one urgent truth. Time is brain. In stark terms, this means that every passing second after a stroke begins, nearly 2 million neurons can die. The longer treatment is delayed, the greater the brain damage, and the slimmer the hope of recovery. That's why fast action isn't just beneficial, it's essential. Doctors often talk about the golden window, a 3 to 4.5 hour time frame after symptoms start, when stroke treatment can be most effective. If blood flow to the brain is blocked by a clot, patients may qualify for TPA, tissue plasminogen activator, a medication that can actively dissolve the clot and restore circulation. When administered promptly, TPA can substantially reduce both brain damage and long-term disability. But once the golden window closes, the risks of administering TPA outweigh its benefits. Beyond that point, it can cause serious, life-threatening bleeding in the brain. Consider two scenarios. The first involves someone who recognizes speech trouble or arm weakness and calls 911 within 1 hour. They're rushed to the hospital, receive TPA, and leave with little to no lasting damage. In the second case, the individual dismisses the symptoms as fatigue or age-related, delaying emergency services for 5 hours. By that time, the golden window is closed. No TPA is given, and the patient leaves severely disabled, unable to speak, walk, or manage daily living. The stark contrast: just 4 hours. Despite this, Many stroke victims delay seeking help. A common mistake is hoping symptoms will disappear. Others worry about causing panic or inconveniently calling family. Some attribute early signs, numbness, dizziness, slurred speech, to fatigue, stress, or low blood pressure. Seniors especially may rationalize symptoms as part of getting old, believing nothing urgent is happening. But in the context of stroke, even a pause in delaying action can result in irreversible loss. As time ticks away, healthy brain tissue is ruined. A delay allows the clot to block critical areas longer, causing a domino effect of damage. As cell death spreads, functions like speech, movement, and memory unravel. This is what makes stroke distinct from many illnesses. It punishes procrastination with permanent consequence. Once the critical treatment window passes, options become far more limited. Thrombectomy. Physically removing the clot may still be possible, but it carries risk and depends on when the patient arrives. Rehabilitation often becomes the default, whether or not it can fully reverse the damage. But rising stroke rates and an aging population in the U.S. make early recognition and treatment more crucial than ever. Delayed treatment can lead to devastating outcomes. Loss of speech, loss of movement, loss of independence. They're all too common. Imagine never laughing, never speaking clearly, never walking your grandchild to school. These aren't worst-case scenarios. They become reality when strokes are ignored too long. But the blink of an eye difference between acting and waiting could resurrect a life. Quick response by recognizing the signs, slurred speech, facial drooping, and arm weakness, and calling 911 can mean the difference between full recovery and permanent injury. It's why campaigns like FAST, Face, Arms, Speech, Time exist, to teach people to identify and respond rapidly to stroke symptoms. FAST education isn't just for medical professionals, it's for every household. Imagine if everyone knew the signs and was ready to call 911 at the earliest confusion. How many lives could be saved? How many families could avoid the heartbreak of watching a loved one struggle to walk or talk? There's no reason to wait for confirmation. If any symptom appears suddenly, even if it feels minor, call emergency services immediately. Treat it like the emergency it may be. Don't drive, don't wait, don't second guess. Just call. Remember, when it comes to stroke, every second a person delays is time their brain loses. Recovery demands speed. Brain survival prepares on speed. Life may even depend on speed. So the critical truth is clear. Time is brain, and delay leads to damage. Yet the question remains, what if there was a way to spot those early signs instantly, without needing medical training? When a stroke begins, it often arrives silently and unassumingly. There is no dramatic collapse or sudden pain, just a subtle shift, a slurred word, an arm that droops for a few seconds, an expression of confusion. In those fleeting moments, remembering fast face, arms, speech, and time can mean the difference between life and irreversible loss. Would you have face? Ask the person to smile. Does one side of their face droop? A crooked smile may be the earliest visible signal of facial muscle weakness, indicating a stroke has started affecting the brain's motor control centers. Arms. Ask them to raise both arms. Does one arm drift downward or remain unlifeable? Sudden weakness or numbness on one side of the body is a classic and urgent stroke symptom, even if it seems minor. Speech. Ask them to repeat a simple phrase. The sky is blue today, or I love sunny days. Is their speech slurred, hesitant, or incorrect? Do they use the wrong words or struggle to form complete sentences? Speech problems are one of the earliest and most common signs of stroke. Time. This method isn't just about checking symptoms, it's about acting fast. If any of these are present, call 911 immediately. Don't wait, don't drive them yourself. Emergency responders can begin life-saving treatment en route and alert the hospital in advance, making every minute count. Imagine this scenario. You're at home with your spouse or parent, enjoying a peaceable breakfast. Suddenly they say, I need the, thing and trail off mid-sentence. You feel something is wrong. You check fast. The smile is uneven, the arm drifts, and the speech is garbled. All signs point to stroke. You call 911. Within 30 seconds you've acted. That moment could preserve their independence and their relationship with you. The secret of FAST lies in its combination of simplicity and speed. In a typical household, spotting a stroke quickly and calling for help can mean the difference between walking away from the hospital or facing lifelong disability. Toward that goal, families must prepare. First, post a FAST reminder where everyone sees it, on the fridge, bathroom mirror, bedside wall, or even as a lock screen image on phones. Some families use colorful magnets or simple drawings to prompt an immediate check if something seems off. Second, store your local emergency number or 911 in speed dial. Speed matters. During a stroke, thinking through the problem can cost precious time. Third, educate every generation in the household, grandchildren, caregivers, even visiting friends. Do a mock drill. Sit facing each other. Ask someone to smile, raise arms, repeat a phrase, and confirm time. Teach FAST like a basic safety code, not a medical dictation. When time is limited, training becomes instinct. Consider what paramedics bring in their ambulances: oxygen, heart monitors, streamlined protocols, and direct communication with the hospital. Those extra tools matter. Driving yourself means losing that advantage. Even a few minutes can translate into improved recovery and fewer long-term deficits. Time is the enemy of the stroke victim. Every minute's delay means more brain cells lost, harder rehabilitation, and lower odds of full recovery. Patients treated within 90 minutes often avoid long-term disability altogether, but waiting 2 or 3 hours drastically reduces that chance. Yet despite what families know, many stroke victims hesitate. They hope the symptom will pass, or feel embarrassed. They brush it off as tiredness or aging. Seniors especially may downplay the risk, hoping not to alarm loved ones. This hesitation costs lives. When stroke is suspected, do not wait for confirmation or symptoms to get worse. If you notice facial drooping, arm weakness, or slurred speech, even if brief, call emergency help now. Treat the silent alarm as the real thing. This could prevent a minor stroke from becoming catastrophic. A well-prepared family can make all the difference. You might consider making a simple stroke info folder that includes FAST guidelines, a list of local hospitals, emergency contacts for immediate family, and private insurance or Medicare numbers. Keep it in a kitchen drawer or wallet. You can also set up a stroke checklist in a visible place. Include FAST acronym and steps, emergency contacts, numbers and names, hospital address, handy tips, e.g., don't drive, don't wait, a reminder to alert neighbors or friends. If you live alone, plan ahead. Share your FAST plan with a trusted neighbor or phone buddy who'll check in regularly, especially during stress or medication changes. Have a neighbor you can call or who will call you if they notice unusual behavior. Stroke doesn't wait for your convenience. It doesn't pause because you're busy, tired, or don't want to bother anyone. If it begins with facial droop, arm weakness, or speech problems, don't assume it will pass. Don't chalk it up to fatigue or stress. Treat it as a medical emergency. Call 911 and keep monitoring until help arrives. The impact goes beyond one person. Families breathe easier knowing they have this knowledge. Communities act faster. Lives stay intact. FAST saves lives because it combines speed and clarity. It directs non-experts to act before the brain shuts down. It restores time and respect to families facing emergencies. It brings medical help inside moments. And here's what to remember. The warning may come softly, but the choice to act must come fast. Because what you do next changes everything. If this video helped clarify what to watch for, or you know someone who should see it, hit the like button, subscribe to Senior Health Tips, and tap the notification bell so you never miss a tip that can save a life. Thank you for watching. Stay alert, stay prepared, and protect the voices and lives of those you love.